Dr. Amy Doneen, and I reside in Spokane, Washington, and I own and run the Prevention Center for Heart and Brain Health. I have worked for 20 plus years with Dr. Bradley Bale, and we have the BaleDoneen method, which is aimed at teaching providers and educating the public on heart disease, brain health. Our latest book is called Healthy Heart, Healthy Brain, and it really is for the public to bring awareness and knowledge and provide an action plan on what they should ask their dental provider, what they should ask their medical provider on how to stay healthy. Red flags are fun. So red flags don't necessarily have a cause and effect. Something that has a cause and effect is proven to cause something. And when you remove that threat, it's proven to make that thing better. Red flags are different. They're just observations in the literature that say people are at higher risk. I'll give you an example, like migraine headache, for example. People who have migraines, both men and women, have a dramatically increased risk throughout their lifetime to have strokes and vascular disease. And we honestly don't know why. Is it that they haven't slept well for decades? Is it that they've dealt with the psychosocial trauma of missing work because of their headaches? Is it that they've had a lifelong use of non-steroidal anti-inflammatory drugs like ibuprofen chronically that increases their stroke risk threefold? So we don't know if it's the pathology even of the migraine, but we do know this. If we see a migraine history on a health history, we want to nurture that person and make sure they're wrapped in optimal care so we can avoid the end-stage disease that a lot of migraine sufferers have. We know things like male pattern baldness, so thinning hair in the front or thinning hair in the back is a precursor of an increased risk for heart disease, about 40%. There's something called Frank's sign, which is an interesting diagonal crease on the earlobe that becomes more pronounced as we age. It could be in one earlobe or both. But people who carry this little ridge, it's called Frank's sign, have about a 78% increased risk of having multi-vessel coronary disease. It's a great example of a red flag. We can't go get surgery and make that go away and then have the risk mitigated. What are some others that we might even see in the dental chair for people? People who have fatty deposits on their eyelid or on where their skin is thin. Those individuals really are showing you that they're having a hard time depositing all the lipids that they're dealing with. So these people have really a predisposition to metabolic syndrome, diabetes, and heart disease. There's so many of these red flags. Even those fatty deposits can be on the inside of the cheek. They're called Fordyce granules. Those patients, if they come into a dental practice, it's a simple question of, hey, have you had your cholesterol checked? Who's your doctor? Let me call them and tell them that I'm seeing this and start building those bridges across the community to make sure these patients who have no idea that these visual signs are telling a story. Those are good examples of red flags.